My name is Humberto. I work as a psychotherapist at Children's Hospital, providing mental health services to children between the ages of 5 and 18 years old. I've been working there for the past 8 years. So once again, welcome to our community town hall. And what a great turnout, looking at the numbers here. And any number of you have shown up for this evening. We certainly know you have a choice with regard to where you might be tonight. So thank you again for coming. And in fact, as I'm counting, we've got 69 participants who are here. 70. Do I hear 71? Do I hear 71? Okay, there it is, 71. Thank you very much. All right, very good. So we know how important Children's Hospital is to our community. It would be hard to exaggerate the value provided by the hospital to families and children of the East Bay. Before taking the next step, one small caveat. Here's a bit of bad news, in other words. This is actually our first virtual community town hall event. So please bear with us as we adjust the limitations of the technology. I see you all bearing. Thank you very much. Keep bearing. So now, as you know, tonight we're bringing together healthcare workers, community, and parent advocates to talk about the special role Children's Hospital Oakland has in supporting our community and how things are changing at our hospital under the UCSF affiliation. So we have a packed agenda. We will be moving quickly through it. But first, just a little bit of housekeeping.
Hi, everyone. Nice to meet many of you. My name is Yari, and I am a member of East Bay chapter of the Democratic Socialists of America, DSA. And East Bay DSA, just want to say, is super proud to be here organizing with the workers of Children's Hospital Oakland. We know that we need a healthcare system that prioritizes the health of working class Americans. And we know that workers must cultivate strong unions in order to assert their power and advance the collective interests as workers and as part of the broader working class here in the East Bay. So very glad to be here with you in solidarity this evening. And many of my comrades I see are also here as members of the town hall. So just to go over the housekeeping really quickly, this is a webinar, as you may have noticed. So we are, with the number of attendees that we have, we're just going to have everyone on mute, and that will allow the speakers and panelists to flow through their presentations. But there will be a Q&A session at the end of the town hall. So throughout, please feel free to use the Q&A button at the bottom of your screen to enter in questions. And then at the end, we'll have time to get through as many questions as we have time for. So again, there should be a little Q&A button at the bottom of your screen. You'll see a window and you can put in your questions there at any time, but we'll save the answers to the questions to the end of the session. And if you have a question for a specific speaker or a panelist, please do be sure to add their name so that we can have the appropriate party answer the questions. Again, we're going to work to answer as many questions as thoroughly as possible, time permitting.
Very good. Thank you so much, Yari, for that bit of housekeeping. Keep ourselves tidy and organized. So now I'd like to acknowledge some of the organizations and elected and community leaders who are here to support us. We are indeed honored to welcome Oakland City Council member Dan Kalb, whose district includes Children's Hospital. Additionally, Council member and mayoral candidate Sheng Tao. And finally, but certainly not least, newly elected Assembly Member Mia Bonta. We also have staff representing several East Bay elected officials, including Assembly Member Buffy Wicks, Senator Nancy Skinner, Oakland City Council Member Nikki Fortunato Bass, and Carol Five, Alameda County Supervisor Keith Carson, Dave Brown, and Nate Miley, and finally, but not least, Oakland Vice Mayor Rebecca Kaplan. Now, that's not all. We have some more mentionables here. We also have some beautiful community support here with representatives from several organizations. To name but a few, we have Asian Pacific American Labor Alliance, Golden Gate Community Association, East Bay DSA, of which I am a proud member, Berkeley Progressive Alliance, Oakland Progressive Alliance, Parent Voices Oakland. And I toss it back to Yari.
Great. And I'm just going to go over the agenda before we get started. So again, we're here to learn more about what's going on at Children's Hospital Oakland and how we can keep care in Oakland and keep East Bay kids healthy. So first, we're going to start with an informative presentation with some grounding and context. Then we'll move into a great set of panelists who are going to talk about the impact of our hospital on the community and how it's changing. And then after that, some of the healthcare workers at Children's are going to share stories of what they've been seeing of these changes in their daily work. And then we will give our elected officials who are here a chance to react to what they've heard. And that's at that point, we'll then move into the Q&A session where you all will get some time to ask some questions and make some comments, share some love. So with that, let's get started. First up is Laura Nakamura, cardiac sonographer at the Children's Hospital Walnut Creek Clinic, with some grounding and some context about what's going on at UCSF Benioff Children's Hospital, Oakland. Laura, over to you.
Great, thanks, Yari. Thank you very much. Do we have the slides? Thank you. Great, great. I'm glad to see everyone here tonight. Children's Hospital Oakland, or CHO, as employees like to call it for short, was founded over 100 years ago in 1912 as a hospital just for babies. It has grown to about 200 beds and is one of the best pediatric care centers in the nation, known for excellent research and acute care, notably for its work on sickle cell anemia. CHO is one of 5 level 1 pediatric trauma centers in California, serving patients as far as the Oregon border. It's important to note that CHO accepts all patients in need of care, regardless of their ability to pay. As you will hear from the panelists later on, CHO's community orientation and culture of care have made it an invaluable resource to generations of Californians from the East Bay and beyond. Next. And one more, please. Thank you. CHO's nonprofit status and mission of providing all families and children with excellent patient care, regardless of their insurance or ability to pay, has meant that it has always struggled with financial instability. In 2014, Children's Hospital Oakland affiliated with UCSF and was renamed UCSF Benioff Children's Hospital Oakland. The affiliation was supposed to stabilize CHO financially while allowing the hospital to remain a separate nonprofit entity. According to a recent article in Oakland Side, the affiliation also promised to help the hospital get more involved in academic research and have greater access to philanthropic donations. But doctors, nurses, healthcare workers, and patients CHO serves tell a different story. Next. Within just a few years of the affiliation, the hospital was bleeding doctors and patients couldn't get routine psychiatric appointments or see lung specialists. In 2018, 120 physicians sent a public letter to UCSF Chancellor Sam Hawgood calling on UCSF to stop funneling services and patients to UCSF Mission Bay. Next. Over the summer, nurses organized a forum to highlight the issues they've seen. As part of the panel, a former CHO board member, Jeff Chung, talked about the inequity of how UCSF was distributing resources. In the panel portion of that forum, one of the organizers of that event, Martha Kuhl, will be talking about the nurses' efforts to get more information and hold UCSF accountable. UCSF has denied allegations that they are funneling patients or resources to San Francisco and has refused to comply with requests for information. NUHW investigated this claim by comparing publicly available patient utilization data held by California's Office of Statewide Health Planning and Development, OSHPD, for both UCSF Children's Hospital in Oakland and UCSF Mission Bay, UCSF Health's San Francisco-based Children's Hospital. We compared those utilization reviews with population changes in the city and East Bay, and the numbers were pretty suggestive. San Francisco's child population percentage, next slide. San Francisco's child population percentage is among the lowest in the nation at 13.4% and has approximately 1,700 residents age 18 under, according to a 2020 census. By contrast, the East Bay child population's percentage is in line with the national average of 22%, 20.3 for Alameda and 22.4 for Contra Costa. There are a total of 117,111 residents aged 18 and under in the city. In the East Bay, that number is 600 to 684. The East Bay has more than 5 times the number of children. The East Bay population is also growing faster than San Francisco's, with a growth rate of 13% versus 8% in the city. Given that UCSF Benioff's Children's Oakland serves a larger population of children in its immediate vicinity than UCSF Children's Hospital in Mission Bay, it would be reasonable to assume that it would also serve more patients, but that's not the case. Next slide. From 2014, the first year that UCSF affiliated with Children's Hospital Oakland, to 2020, the most recent year to which data is publicly available, surgical operations at UCSF Benioff Children's Hospital Oakland fell nearly 24%. The number of operations fell from 8,185 in 2014 to 6,608 in 2020. During this time period, patient days fell nearly 18%, going from 46,971 in 2014 to 39,936 in 2020. While surgical operations and patient census figures have declined at UCSF Benioff Children's Hospital Oakland, the opposite is true for UCSF Mission Bay. From 2016, the hospital's first full operating year, to 2020, the surgical services increased nearly 5%, increasing from 15,310 in 2016 to 16,043 in 2020. Similarly, patient days have increased nearly 2.5%. Next slide. Comparing utilization rates. Even if you don't include 2020, given that hospitalizations were down across the board because of the pandemic, the trend remains the same. Between 2016 and 2019, patient census days increased almost 8% at UCSF's Children's Hospital Mission Bay and fell 5.8% in Oakland. The conclusion here is that given the way our population is changing, services and patient utilization should be increasing in Oakland and decreasing in the city. And this is part of why Children's Hospital workers and patients are so concerned about changes since the UCSF affiliation. The movement of services and resources isn't following patient needs. Instead, resources are moving according to UCSF's bottom line, and it needs to change. I want to thank you for your time. I want to thank you all for being here tonight. If you have any questions or comments, please note them down, put them in the Q&A section. We'll have time for them at the end of the panel. Now I'd like to hand it off to my co-worker, Darby Schouten, who will be introducing us to some of the panelists who've come to talk about what this movement of resources looks like firsthand. Thank you.
Thank you, Laura, for that presentation. Very informative. My name is Darby Schouten. I'm a clinical social worker at Children's Hospital Oakland for the past 24 years. Now it's time to hear from our panelists about what our hospital means to the community and how the changes are impacting patients. The first panelist that I would like to introduce is Clarissa Douthard. Clarissa is the Executive Director of Parent Voices Oakland, an East Bay chapter of Parent Voices California. Over the last decade, Clarissa has been a strong advocate for mothers like herself who are caught in the crosshairs of negative public policy, ineffective public policy. As a collaborative movement builder, Clarissa has developed partnerships with large local government agencies, supported multiple coalitions focused on early childhood systems, and led countywide grassroots campaigns that expand access to childcare, healthcare, and housing services. Welcome, Clarissa. Happy to have you here. Could you tell us a bit about your experience at Children's?
Sure. First of all, I just want to thank you all for being here this evening and for having me in this space. I want to really, really express so much gratitude for the National Union of Healthcare Workers and all of the work that you're doing. Um, and thank you for the introduction, because I didn't have to say all that myself. I also just want to add that I'm a co-chair for the Oakland Progressive Alliance, and some of our partners are here tonight. So I want to acknowledge that, and also part of the Care for Kids Coalition, which was the coalition that came out of Measure C, which if there's time, I'm happy to talk about. That was an investment in our care economy here locally in Alameda County of $140 million annually. We fought very hard and won that, and in collaboration with community and labor, and would love to talk about that. But the Care for Kids Coalition, Parent Voices, SEIU, NUHW, and our childcare agencies all build coalition there. So thank you so much. So I am typically, it's been a long time since I talked about my personal story, but I feel like it's really important to utilize my story to kind of illustrate the importance of Children's Hospital. And I always said that, let's entertain the possibility that I might fall into extreme wealth and can endow millions of dollars to Children's Hospital, I would do it. That is how I would use any wealth that I had, because this institution absolutely supported my family as a Medi-Cal eligible or Medi-Cal recipient, and as a parent early on in my child's life. My son is 14 years old now. I got into this work absolutely because of him, because we had a lack of childcare access. And I also was housing, I experienced housing instability almost, even before my son was born. So, I became housing unstable when my son, when I was 6 months pregnant. And, I say to people, they ask you if, you have a car seat when you're in the hospital. My son was born at UCSF on Parnassus in San Francisco. He was in the NICU for a week there. And they ask you if you have a car seat, but we usually aren't asking our families if they have housing. And unfortunately, I did have a car seat, but not a place to go to. And it's important to note that, because in the process of trying to find housing, which meant trying to find a job, which meant needing to get childcare, we moved from couch to couch, from home to home. And we're in, basically a shed in a backyard, to be completely transparent. Again, my son was 4 months old and I needed to go back to work. And I was able to get childcare and a part-time job. And then my son started to get very sick. So he was having a lot of respiratory issues. And we found out that he had asthma, and we were on Medi-Cal, but it kept getting cut off. We're having a lot of issues with eligibility, even though, we were certainly eligible. And, my situation, working part-time, being housing and, having real issues securing stable housing, and going from system to system. I think I received probably 5 or 6 different types of government assistance as I was trying to cobble together a stable life for us. And this is just so I could work, right? And also I want to note that this was 14 years ago. My son is 14. Right? We now have a pandemic and families with very complicated lives now. So I know that we have limited time, but I'll say that, Children's was absolutely instrumental. My son had moderate to severe asthma that landed him into the hospital multiple times. I was in emergency rooms with him. I did not have sick time. I was working part-time. I didn't have sick days. I didn't have paid sick days. That hadn't happened yet. It was in 2012. So thank you to everyone in city of Oakland that fought for that, but that hadn't happened yet. So if I missed a day of work, that meant food that wasn't on the table. I'm going from, one agency to another, filling it out and recertifying for every program imaginable. And my son, in the midst of this, has asthma. He had pneumonia repeatedly. He was in and out of the hospital. We had transportation issues. And throughout all of that, Children's Hospital, the workers there, everyone from social workers to folks in eligibility and payments to the doctors, all of the staff really surrounded us and supported us, knowing that I'm not just like every patient. I have a very sick child that I'm in the ER with until 5 o'clock in the morning doing breathing treatments. And I have to go to work in a few hours and beg my childcare provider to take my child who is sick so that I can go and work. And I had got there, by the way, on a taxi cab. So if I were in a situation where I had to go to Mission Bay, forget about it. Again, my son, he was hospitalized several times, and these were life and death situations. And I don't know where I would be if I wasn't close to home, if there weren't workers there and healthcare workers there who understood that I was having a rough time, who didn't marginalize or judge me or question me around that, and just provided the care that my son needed.
Wow. Thank you for sharing that. That was one of my questions, but I think you answered it. Was what would be the impact? If back in time they said, hey, we're cutting that service, or you have to go across the bay, you listed a number of barriers that you would have trying to get services across the bay. And I do think that we have such a great group of staff that are really focused on our community's needs. And that leads to another question. I know we don't have a lot of time, but I would want to know about just what does CHO represent to the members of Parent Voices Oakland? Like how are they impacted by CHO and the relationship? And
yeah, I think it's similar to myself, which is why I wanted to talk about this. I mean, we got to know my son's pediatrician really well. We still know my son's pediatrician. There are these long-term relationships that have been built. Our organization is housed in Bananas, which is right next door to the pediatric clinic on Claremont. And I have been there. I have worked at Bananas, inside Bananas for PVO for 10 years. And so I was constantly going back and forth. Our folks come over to Bananas from the clinic and or they're across the street, right? And getting services across the street. And I think that one of the things that I would highlight that, people have to understand about systems when they really work and are community centered, again, are those both formal structures that support the whole family, and also those informal structures and relationships, the ability to have the ability in our imperfect healthcare system, to put it mildly, support families and meet them where they are at. And because people are coming from immigrant communities, people are coming from different socioeconomic backgrounds, and we were able to partner with and be a part of piloting different ways of referring families to services in a more integrated and holistic way, so that families aren't hopping on bus to bus to bus going to different agencies to get their needs met. That Children's has made an effort to really pull together a set of comprehensive services and make things as easy and streamlined as possible, but doing that in a way that's patient-centered and focused, so that families, what they need to worry about is being there for their child, right? That's the thing that they need to be most concerned about, the most important thing. You don't know how important it is, though, to have those relationships until your child is strapped to a gurney at 3 o'clock in the morning, right? Mm-hmm. Going into an ambulance. And I think no parent should be having to worry, about their relationship with their doctor, or what's gonna, those relationships are really critical and impact the health and well-being of the child as well as the parent.
Yeah, thank you so much for that. And thank you for Parent Voices Oakland. I know the work they did on Measure C just was so impressive. And we thank you for that commitment. And that is what community is all about when we work together, not far flung where people are outside their community trying to get services. So I thank you so much for your time. Our next presenter is Martha Kuhl. Martha has been an RN for over 40 years and has worked at CHO for over 39 of those years. She has advocated for patients, their families, our communities, and for nurses and healthcare justice for as long as she's been a nurse. She is the treasurer of California Nurses Association and the first vice president of the Alameda Labor Council. Welcome, Martha.
Hi, thank you for that introduction.
Oh, you're welcome. You're welcome. Can you talk about what's going on with the transfer center and how the nurses have been trying to get information from UCSF?
Yeah, yes. And that's a really good question. What is going on with the transfer center? So we've been asking many questions for the last several years, just as NUHW has, about what's actually happening. And I'm just going to read a couple of the questions. We did information requests in 19, 20, 21, and essentially received no information back. One of the questions was, provide a list of specialties and doctors whose practices were at CHO and changes since the affiliation. No answer, right? Please provide information about planning for the future of research after they decimated research at CHORI. No answer. Please provide information about planning the preservation of specialty medical and surgical services at Oakland. No answer. And then, please describe who is deciding at which campus a patient will receive care. Please describe the criteria used in this decision, because nurses and other healthcare workers and doctors had noticed that patients were being funneled away from Children's, right? So we wanted to know what was going on. We also heard that there were algorithms that the people who answer at the transfer center about how to direct patients and which patients to direct where. So we really wanted to find out why it was so skewed. And anecdotally, I think some of people are going to talk about this tonight, but anecdotally, we've been hearing that kids with insurance are being directed one direction, and kids without insurance are being kept at Children's. Now, that's fine with me in terms of our mission and what we want to do as a safety net hospital. But if they're doing it deliberately to starve us, that's another thing. So that is a good question. And there are algorithms. I've seen one which directs all the complex, highly reimbursed cardiac surgeries to Mission Bay. And much fewer surgeries, as you showed, are happening here at Children's. So, and we've been asking these questions now for a couple of years, and we're gathering information. All the workers here and workers, others who aren't present, have been feeding us information. Some of the doctors have been telling us about what's been being cut. And I want to talk just a little bit about some of the cuts that I've noticed. Because I'm a hematology oncology nurse, so we certainly noticed the decimation of the sickle cell program over the years. They're sort of beginning to rebuild it, but they lost many of the caregivers in that program, and those clinics are still understaffed, and people are doing double duty and various roles. It's been rough. And then listening to Clarissa, we know we have many fewer pulmonologists now than we had a few years ago. There's only 3, as far as I know, and that's a reduction from before the affiliation of 7. And respiratory illness is one of the major reasons kids are hospitalized. So to have reduced that service has had a significant effect on our patients and this population, not to mention, longer waits for care, less prevention of illness, all those things that harms our patients.
Wow. Thank you for touching on that, Martha.
Yeah.
I think those are so important. highlight these concerns, and the fact that there aren't answers is really concerning. Along the lines of staff shortages, could you talk a little bit about the impact of staffing shortages amongst the nurses, and what are you seeing? What are the effects of that?
It's been, during the pandemic and the census was significantly reduced, we were fine. But the employers stopped hiring, allowed the attrition instituted a hiring freeze. And for a while, it didn't affect things because the census was down. But as kids have gone back to school this year, as the vaccine's been out, as more people are out and about, the census has gone back up. Now, mind you, the census hasn't gone as high as it was several winters ago, where the entire hospital would be jam-packed and horrible long lines waiting. But there are still units closed. So there's 20 beds closed at our offsite summit unit and 10 beds closed in a 3 surge unit. That's 30 beds that are closed. We aren't admitting to every bed in the inpatient areas. And we have the beautiful new PICU, but we don't have enough staff to staff all those beds, right? And it's now a bad respiratory season. And I want to say they must be directing patients somewhere else, because it is turning into a very bad respiratory season, it looks like, between all the different viruses that are now circulating like crazy that didn't happen last year, thanks to all our masking. And we just don't have enough staff. And I want to say that it's not just nurses who don't have enough staff. We are having difficulty. There aren't enough environmental service workers to clean the rooms for patient turnover, so we can get a kid out of the ED into a bed. There's all kinds of things like that. There's tons of supply shortages, making it very difficult. We are told that we can't use our patient care assistants, or we might not get a unit clerk. There's like all of us are working together to provide this care. And
Wow.
All the departments, some of the people I don't know because I don't personally work them, but I certainly know our social workers who work with all our hem-onc kids and all this, and everybody's really running to provide the care.
Wow.
And they instituted not just the hiring freeze, but a very, very extreme tight position control system, so that you not only have to demonstrate a need, but you have to prove that it's going to be efficient and add to revenue.
I really appreciate you bringing that up and all that you're sharing, because that is something that I'm seeing as well, is that if you don't meet productivity quotas, they won't fill the position. And social work, mental health clinicians like myself have been very short-staffed. So I really appreciate all of your work, Martha, and for you speaking up about these needs. Thank you so much for joining our panel tonight.
Well, thank you guys for all the work you're doing on this too. It's critical to not just for us as workers, but our community. And I think I'm just going to say this because I know I've worked here all these years, because we are a safety net hospital, because we do know our mission and we are dedicated to it. And that's one thing UCSF is trying to undo.
Thank you so much. Yeah. Well, our next panelist I would like to welcome is Fran Merriweather. Fran Merriweather is a clinical social worker and the clinical coordinator for the high-risk infant follow-up clinic at Children's Hospital, Oakland. She's been at our hospital for over 30 years, is a union steward, and a member of our bargaining team. Welcome, Fran.
Oh, thank you. And I'm so glad to see everyone here tonight.
Wonderful. Could you tell us a little bit about your department and the work that you do?
Well, the neonatal follow-up program is one that through grant funding from Alameda County has a program called Special Start, and it's a home visiting program targeted to for families who have had children in the NICU. And it's a case management model We are able to follow those families for up to 3 years, and we provide developmental, medical, and psychosocial support to families who are just beginning their journey of caring for a child who has spent time in the NICU. And many of these children will have special needs and are medically complex. And some are just what we call feeder growers, but they are families who need support. And it's not just the baby who's the primary client. Our families have so many stresses. We know that we serve a population that is eligible, 70% is eligible for Medi-Cal. So they're struggling financially. Many of our families are struggling emotionally. They struggle with issues of housing, of food security, and our case managers do an incredible job of taking care of helping them not only navigate systems to take care of their baby who's just come out of the NICU, but for navigating all of the other issues that come up in life for them. And oftentimes they're helping with other family members as well. It's everything. We have a large immigrant population that needs care and assistance as they navigate these systems. And we have families who are traumatized on all kinds of levels. So that's what we do in Special Start. And our high-risk infant follow-up clinic sees many of those NICU babies to make sure that they are hitting their developmental milestones. And if they're not, providing whatever support a family needs so that their child can reach their potential, and that the family can feel assured that all is being done to help their baby. So that is what the clinic does.
It's so wonderful. And I know firsthand, having worked with you, the wonderful work you do and how supported the families are. Maybe tell us a little bit more about how that impacts the general community, the work you do with these families.
Well, I just think it's critical because our case managers, I'm no longer a case manager, but did it for many years. And one of our case managers, Peggy Busher, will speak on issues specific to what it means to help a family, is that we are there from the beginning. And it doesn't, and many case managers can tell you that families call even after their child is 3 years old. So it is being that critical connection for families, some of whom have not had good experiences with medical systems. Many of our families are families of color. They deal with the issues of what it means to be a person of color in this culture. If families have immigrated, they are also dealing with issues of what it means to feel safe or unsafe, depending on what your immigration status is. So it's so vitally important that they know that there is a place and a space to be for them and their family.
Yeah, thank you. And what changes have you noticed with the affiliation with UCSF, and what do you think about that?
Well, I've noticed an exodus of experienced staff who get to know families, has speakers before me, and I think Clarissa so beautifully outlined, get to know them and know what the struggles are and what ways families need help. I also am worried about the funneling of families to the West Side, Mission Bay side, because for me, the biggest issue is what does that do to access for families on this side? We have families who struggle to get to children's, and thankfully we are here. And once they're here, the struggle isn't over, but we work on ways to make that happen. I don't know what the commitment is to make sure that happens if families are transferred and being made or being asked or being directed to the West Side. It's a different culture. It's a different climate. It's a different way of doing work. We are part of this community. Many of us live in this community. We are seeing generations of families now. We're on our second and third generation of kids coming from some of the same families. So I am worried about that. I'm worried about staffing. I'm worried about continuity and what that means for families, what that means for workers. So I'm worried about the financial stability of children's, because if you are, again, directing people with commercial insurance away, and then saying that we serve such a large population of families who have Medi-Cal. Thank goodness for Medi-Cal. But you also can use that as an excuse as to why other services can't be created or can't be sustained. And I'm worried about that as well. Medi-Cal is a lifesaver, and we need those. We need families, and we need Medi-Cal, and we need families to be assured that because you are on Medi-Cal means that you will be serviced in no less a way, in an equitable way as anyone else. And I hope families know that and hear that, but I'm afraid and I'm worried about the changes that are happening that may be sending an implicit message that that isn't so. And families pick up on these things. They really do. So I want equity for our families on this side. They deserve that.
Absolutely. I agree 100% that our families do notice when really talented doctors are no longer at our hospital, and they worry that they will receive high quality care, that they will be seen and heard. And I so appreciate you, and we all appreciate the work you've done in this community, and that you've given a voice to so many people.
And I just want to say, I'm thankful for our medical community that is invested. I remember when Assembly Council Member Dan Kalb had the first town hall, there were community physicians who were concerned, and they continue to be concerned. And I would like to say that part of what we are in UHW are doing is fighting for these things for families and workers. And one of the reasons that we are invested in something called successorship is so that we can have a voice in what happens to this side of the Bay. We are concerned about the East Bay, and we want this community to thrive. And we know there are so many pressures right now for our families. So I'm hoping that the administrators of UCSF hear our plea, hear our cry, and hear the families and the providers, please.
Thank you so much. And your passion speaks loud and clear. You've dedicated your life and your career to this work. And I hope that is the message that UCSF can see, is that we are about supporting the family.
Yes.
Thank you so much, Fran. I really appreciate it. And thank you to all of our panelists, for sharing your stories, and also for the important work that you do. So valuable. We've been hearing a lot about services moving across the Bay, but we wanted to give you a picture of how this comes up in day-to-day settings, and how it affects patients. So we're going to have a few people share some quick anecdotes about how they've seen this affect patient care. So we're going to speak to a few members. So the first member I'd like to welcome is someone that Fran had mentioned, is Peggy Busher. Peggy is a social worker, clinical social worker 3. And Peggy, could you share with us just some of your experiences of how this moving services across the Bay, how it's impacted a family you've worked with?
Yes, thank you, Darby. And thank you, Fran, for, I almost wanted to cry when you described our program, because it's so special to us and to our families. The story that I wanted to share with you tonight was about a family, a patient who was in our program a few years back. I chose this because I think we have lots of families who have these kinds of struggles and barriers to getting care. So my client had developmental delays and problems with his muscle tone. He had diagnostic workup at our hospital, but his diagnosis was still unclear. He was nearly 3 years old and he was unable to walk, which meant that without a diagnosis, he might lose access to his physical and occupational therapies. His neurologist at Cho referred him to a specialist at UCSF to clarify the diagnosis. This family lived not more than 15 miles from UCSF, yet it was incredibly challenging to access this specialty care. The family didn't have a working car, so I arranged for medical transportation through a van service, paid for through CCS, California Children's Services. However, the patient had 3 school-age brothers and an infant sister. The family lived in a 3rd-floor walk-up apartment in Oakland, and mother couldn't safely carry both the patient and the infant down the stairs. The other issue was that the older boys couldn't be dropped off at school unsupervised at the hour that was needed to make it to the appointment. Fortunately, the driver knew the family from transporting them previously, and she's one of these wonderful people who just goes out of her way. That's part of Children's. And she drove, she got them down, all the kids down, and then she drove the mother and all 5 children to the elementary school where I met them and stayed with them on the yard until school started. Mother kept the oldest child out of school because once dropped off at UCSF, she couldn't manage both the infant and the patient, given that they weren't ambulatory and the family only had a stroller for one child. I drove to UCSF and met them just as they were being called into the clinic. We soon discovered that the clinic model was very different from how our clinics work in Oakland. Once in a room, there began a long stream of residents who one by one would introduce themselves and then review the patient's medical history. After telling the child's medical story several times over, the mother became really anxious to meet the actual specialist. She politely explained that she had time limitations due to her older siblings' school release time. Eventually, the specialist entered the room and was able to examine the child. By then, the van driver was already waiting to take the family back to the school to pick up the children in Oakland. I supported the mother in again explaining the family's circumstances and their need to leave, and suggested that additional appointment could be scheduled. The specialist said that more tests would be scheduled for the patient, some of which required lab draw. He was very insistent that lab work be done before leaving the facility. Mother agreed, but then went directly to the waiting transportation in order to not lose the transport across the bay and the hope of picking up her children on time. I came away from this experience with the realization that UCSF is not a healthcare system at all suited to serving marginalized families. I was very disappointed that they were so inflexible about meeting the needs of the family. I understand that as a teaching hospital, they need to provide opportunities for the residents to practice their skills, but they consistently ignored the needs of the family, failing to respond even when the mother explained that she risked having police called if she didn't arrive on time. UCSF is just not family-centered. And as I've been hearing the other speakers talk, I just also want to echo that sentiment that Children's is filled with people, no matter what their role, are just anxious to pick up something that the child dropped, to direct a family to where they go. If they, like, we just all really feel in our hearts, our community here, and we want to keep it like that.
Thank you so much. It's such powerful work you do, and that you enabled this family to receive care. And that's what it takes for really complex situations. And thank you so much. So powerful. Our next member that I would like to introduce you to is Ashley Momo. Ashley is a former Children's Hospital Oakland patient. Hi, Ashley. Oh, you're on mute. Oh, you're on mute. Oh, there you go. Welcome.
There we go.
Could you share with us some of your thoughts about what we've been discussing and your own experiences?
Yeah, well, I definitely resonate with a lot of the stories that were shared tonight, especially the last one mentioned. I I'm a Bay Area native, born in Oakland, and a former patient at Children's Hospital. And yeah, growing up with a chronic disease, Children's Hospital played a vital role as a support system for my family and I. It felt more like a community health center than it felt more like a community health center that was warm and compassionate compared to other hospitals. Children's Hospital is truly like a gem. I remember in the day clinic side of the hospital, there used to be like book fairs and Christmas parties that like everyone was invited to. And when I needed inpatient services due to chronic pain, I was met with a solid care team, being that my doctors and nurses were just across the street. And so I would even get visits from my primary doctor, which really made me feel happy and seen. There's definitely definitely a sense of connection and fluid communication between the day clinic and the emergency hospital. But I started to witness a sort of change in the culture once UCSF affiliated with Children's. I would say, although Children's has always been a prevalent research institution, I felt a shift of the priorities becoming studies and researches, especially for a condition like mine, instead of the focus being on a curated health plan. I began to meet with more medical students and groups of doctors who are essentially intrigued by my medical condition. I remember one vivid memory of a hospitalization of mine for pain management, and a group of who I presumed were doctors came in and began to talk about my state of being and did not even acknowledge me. And so, I mean, I know that this town hall meeting is about keeping resources accessible in our community, but I definitely am glad I have this opportunity to share my experience watching UCSF come in and Children's starting to lose its caring and community-centered nature. During my last hospitalization, I no longer felt that playful and vibrant energy in the hospital, and maybe it was because I was getting older and the seriousness of my condition was setting in. But I know for sure that the patients can feel a sense of disconnect in the hospital, which would definitely be exacerbated if clinics and other resources moved across the bridge. So I'm not sure if my clinic in particular would be moved, but as someone who has chronic pain, and already had to drive about 45 minutes to get care, I can't imagine having to make a longer trip into San Francisco. Children is, I call it children, Children's Hospital is definitely a vital member of the East Bay and Oakland community, and definitely embodies that giving nature of Oakland. And so keeping this resourceful healing space for kids and their families in the heart of the Bay is essential. And I hope that the board of directors and other decision makers at UCSF consider including workers and even patients in the decision-making process of the future of Children's. So, thank you.
Thank you, Ashley. It is so important for us to hear a voice of a patient and somebody who really, really has so much experience as a patient at Children's, and you just presented everything so beautifully. I really appreciate that feedback. And I think it does highlight when you have doctors and nurses and staff, even housekeeping staff, right? Like that are all working together.
Mhm.
It's really powerful, that sense of community and caring. And that's what I hear from you, from what you had described. Um, and I appreciate you lending your voice to this cause. It's so important.
Yeah, definitely. I definitely wanted to come here and share my support for the workers who continue to show up for patients despite their questions and concerns being ignored and dismissed. And so I'm optimistic that hopefully their demands will be met soon.
Well, thank you for your support. Really, really appreciate you taking the time.
Of course, thank you.
Thank you. Our next member is Cecilia Morales, and Cecilia is an office associate. Cecilia? I don't know. Oh, I think she's on mute. I'm not sure. I can go back to Laura actually, and then we can go back to Cecilia if she's available. So another member is Laura Nakamura, and she is our cardiac stenographer in the Walnut Creek office. Hi, Laura.
Hey, thank you. I really, going into this tonight, I really didn't think I had any pertinent stories. And then about a week ago, something happened in Walnut Creek that just blew me away. I was in the hallway talking with a provider, and over his shoulder, I saw a woman poke her head out of a door, and she looked like she needed something. So I wrapped up my conversation with the provider and then inquired with her. I'm like, did you need anything? Maybe she had been waiting too long in the room. And so I thought, well, let me just check on her. And she was there actually to see another provider. And she said, I was told I'm not going to say his name. I was told that doctor's not here today. And I'm like, no, he's here. And she said, I've been sitting in here in this room, this exam room, listening to his voice. And she was told by the schedulers that particular provider was not in Walnut Creek and that she was going to have to go to a different location. This is a woman who has a high needs child. She's got, she was trying to coordinate 3 other subspecialties in one location, and she's managing everything. She's a rock star mom advocating for her child. She's got 2 other children, and when she called the scheduling line, she was told that provider was not in Walnut Creek. And the hard part for me is that she was doing the best that she could and was being rerouted. She was being told that provider only goes somewhere else at a UCSF licensed site. And I fortunately for the story has a happy ending because we were able to work her in. The staff in Walnut Creek is amazing. The provider said, yeah, I'm here. And we were able to see her in cardiology, and she wasn't forced to take another day off of work, rearrange the family schedule, take kids out of school for this appointment, and just the additional hardship that could have been was mitigated. And we actually saw her, but I can tell you, she was so upset with being lied to. She was so frustrated. And it really, when you think that UCSF is all about access to care, they claim to be that. This was an example of, no, this wasn't happening in Walnut Creek. This is a mom who was trying to advocate. She knew that this doctor was there, and she was being told, no, that wasn't the case. It was very frustrating, but she actually did give me permission to share this story, and it was definitely a happy ending because all 3 of the subspecialties were coordinated in one place. And I just felt really good about it at the end of the day because we do good work. We do really good work. And I really think that we put our families first, our patients and our families first. And that was at that moment at that day, I was like, we're gonna take care of this. And we did.
Oh, thank you, Laura. I think that's something that we need to highlight, is that sometimes people in positions of power and making decisions live very different lifestyles than many of us, that have so many things on our plate, and to take off work. I've seen that where they say, well, they can just take that off. Well, some jobs, you lose your job. They don't have protection if they take off too many days. So I appreciate you just bringing that up. I know that we probably have so many stories from so many people, but I'm going to thank everybody for sharing so many powerful stories, and I'm going to hand it back to Humberto.
Thank you, Darby. Thank you very much. And by way of a broader summary, still here we've heard stories of passion and commitment and gratitude, but also the stories of concern, of worry, that the most excellent institution that Children's Hospital has been may not continue to be the case. Now we're going to talk more about that as we go along, but let me not step over the that worrisome note. So let us do the next thing here before taking the next step. Let us give a big round of thank yous to all the panelists for sharing your stories, both on the patient side and on the provider side. Absolutely, golf claps are most very much in order, and don't hesitate to rain down thank yous in the chat as much as you can afford. Absolutely. Absolutely. I'll pause here for a second longer to give everybody a chance to take in to respond to the bid. All right, I see the thank yous coming in like a torrent. Keep them coming. So let's do this. I know you all probably have lots of questions and comments. We'd like to first ask some of the elected officials and community leaders for a quick thought. We're going to need to do some quick technical changes. Our tech host, Maggie, Bravo Maggie, is going to promote each of you to panelists so you can be seen and heard by our participants. The elected officials will receive an invitation. Please click yes so we can hear from each of you. And once that's arranged, then we'll take the next step. Okay, I see Councilmember Kalb. Okay. And Councilmember Dow. And I'm waiting for Assemblymember Banta. Okay, very clear, very clear. Okay then, so let us continue then. Councilmember Kalb, we're curious to know if you have any quick responses, questions perhaps?
Thank you. First of all, thank you, NUHW, and everybody who is part of this this important town hall. Really appreciate all the work you're doing. Very much appreciate the tremendous work that all the healthcare workers, and I mean all the healthcare workers at UCSF Children's Hospital do every day in and day out. And the stories of the patients today who share their stories, there are so many more stories just like those. So I just want to acknowledge that. As said towards the beginning, Children's Hospital is so important to Oakland and East Bay families. And the idea that many families, many children with families who live in the East Bay, not just in Oakland, but even farther out in the East Bay, are expected in some cases to go to San Francisco for urgent care or for what they need. That, it's not going to, we can't say that will never happen, but it's happening too much. And that was not the purpose or the goal when the affiliation took place 6-7 years ago. So we have to pull back from that and get back to keeping our families who live in the East Bay at Children's Hospital. And the workers are such an important voice, and they need to continue to be that voice. I just want to acknowledge that, which we heard also earlier, that the critical services that are being, let's say, modified at Children's Hospital, UCSF Children's Hospital, and the patients be forced to go to San Francisco, that should be a thing of the past. That should be an experiment that is over, and we have to pull back and fix that. There are experienced, expert nurses, doctors, healthcare technicians, all sorts of healthcare workers who are in some cases leaving Children's Hospital Oakland, who have been there for many years because they feel they might be able to find better working conditions in other facilities around the Bay Area or beyond. That was not the goal or not the purpose of the affiliation with UCSF. If that's what's happening, we have to rethink that. And UCSF has a responsibility to be accountable to the East Bay community and to do what it takes to make sure we keep our best healthcare workers, which are all our healthcare workers, at Children's Hospital. It's been known for decades as a place. Yes, I would love to work at Children's Hospital. There's competition to get internships and fill vacancies of all sorts of classifications at CHO. And that's been the case for decades. And I hope we don't lose that, because that would be a tragedy. So I don't want to spend a lot of time. I just want to share my appreciation and to remind NUHW and all the healthcare workers and those who represent them that I'm here to do what I can to support your efforts now and in the future. And you have a partner with me in my office, and I know with many other elected officials as well. So I wish you the best, and I'm always here to help. Thank you.
Thank you, Councilmember Calvin. Indeed, it would be a great shame to lose the tremendous expertise that we find at the hospital as a function of poorly supported healthcare workers. So let me now pass the baton here, the mic to Councilmember Tao for your comments or reflections.
Thank you so much. And I just want to appreciate everybody sharing their stories. I think that this is why representation matters so much. And not just representation in regards to how how we look, but also in regards to socioeconomic status. I was on Medi-Cal. My son, when I had him, I'm a single mom, a DV survivor, and I had my son at the county, right? And so I was actually at Martinez County Hospital. But then we moved out here to Oakland, and I remember he had some issues with his knees. One of his leg was longer than the other. We didn't know what was wrong. And it was through Children's Hospital that we were able to get the great care that he needed. Ultimately, his other side of his leg just grew into to what it would be. But I just remember the offer of care, of being there for this very scary moment, knowing that I was a single mom and by myself with my son. We were homeless and living in my car. And it's just the beyond, just like just bringing people into the office, just to bringing them in. It's that kind of closeness that families deserve and need, because in those times of hardship, we have to remember that it's more than just that moment for these families. They have a plethora of other barriers that they are going through, a plethora of other stresses, whether it's not knowing how to feed our kids at the end of the day and trying to figure that out, it's just straight survival mode, right? Housing, I heard earlier, Clarissa was talking about housing insecurity, and so at the end of the day, as healthcare providers and as an organization that actually is supposed to help families and people when they are at probably their worst, it's incredibly important that we break down and take down the barriers. And that means not saying like, okay, well, you're here in Oakland, but you must travel to San Francisco. To many folks, that means getting in the car and going to San Francisco and paying for parking. But for many other folks, that means, baby, we can't go because mommy has to go to work, because we have to pick between, mommy going to work and feeding you and getting you the supplies you need for school, or and buying you your lunch or whatever have you, or going to this appointment and making these decisions. How can we ask people to make these decisions? It's cruel. It's truly cruel. And as an organization in healthcare, I truly believe that we shouldn't allow for profit to somehow trump people's livelihood and their basic needs of healthcare, especially for their children and their families. And I know that even for our nurses, right, our healthcare workers, they develop this connection with families. And not only is it about the families, but it's about the trust that is being built. It's the same relationship as a student would have with their teacher. You wouldn't want to move your student during half of the year and have them move into a different class because they built the relationship with their teachers. And it's exactly the same way. And I would argue it's even more intimate. It's even more intimate. And so for me, having that accessibility is a responsibility that you must uphold. Accessibility is a responsibility that UCSF Benioff Hospital must uphold. And that means truly creating an atmosphere where it's accessible for all families, and understanding that we have to look at this at a lens where we're looking at a family with the least amount of resources. Because I was that family, and I can tell you that for his dental need, the La Clinica that was there at what was then Children's Hospital, you know, I utilized that space, and I was thankful. I was thankful that I had Medi-Cal, right? Although, you know, I feel like, I mean, there's a lot of things that could be better with Medi-Cal, but at least we were able to be seen. And the people who saw us, I didn't feel like they were judging us, that it wasn't a negative stigma behind it. And that is incredibly important, because to feel like you're less because you were born into less, or for whatever reason, you know, that's not appropriate, because at the end of the day, healthcare is a human right. And this is what we all deserve and what we all need.
Thank you for those comments, Councilmember Tao. Yeah, couldn't agree more. Supremely heartfelt, and as you were sharing your account, of course, through my mind flashed the numerous families that I provided support for over the course of the past 8 years, and you know, I'm moved. So thank you for that. So let's see here. What we're going to do now is we're going to come back to one of our panelists who perhaps had some technical difficulties earlier. I'm referring here to Cecilia Morales, if she's on now, for her to come.
Hi everyone. Thank you for your patience. I really appreciate it. Like you said, my name is Cecilia Morales. I am an office associate. I've been at Children's since 2007. I've been working in orthopedics for the past 1.5 years. I do patient checkout and obtain authorizations to transfer patients to other departments within our facility, and also external. I've had families call to ask why they have to go to UC at San Francisco when they want to come to Oakland or one of our satellite clinics in Walnut Creek, but they are being funneled to the city. The majority of the ones that are being moved to the city have private insurances. It's one of the biggest things that I've noticed. I'm also part of the committee of members that meets with Human Relations once per month to discuss these issues. We've asked over and over about employees from UCSF going into the system where new referrals come in and are being funneled to San Francisco Mission Bay. They won't give us any answers, and patients continue to be forced to go to the city against their will. This is very unfair to the families, especially for those that are, again, low income and have no means to travel to San Francisco. And thank you.
Thank you, Cecilia. Thank you very much for your account. Once again, it's a real shame that there's a tremendous amount of need out there, and the thought that Children's Hospital will not be able to serve it as it has done historically, well, that's you know, that rends the heart, quite frankly. It rends the heart. Well, very good. So let's see here. I want to see if Assemblymember Mia Bonta is here. I don't see her on my screen. I'd like to give her an opportunity to respond. If she's on now, she's welcome to share her thoughts.
Hi, just getting the video started. I want to thank you all for sharing your personal stories, and particularly I want to just kind of build on the foundation that Council Pro Tem Sheng Tao offered. I remember being a mother with a 2-year-old who was suffering from a respiratory crisis, and ended up at CHO, and had the beauty and the benefit of people who were open and willing to take care of us with incredible grace during our darkest moment, dealing with a child who we didn't know was going to be able to make it through the night. And I think about the need to be able to have that kind of access to care that you can reach every single day. And the idea that, you know, a bus ride, a BART ride, you know, the thought of having to travel too far to be able to get the care that you need, the thought of having healthcare workers not be able to have the certainty of knowing that they are supporting patients with the quality care that they deserve is quite frankly heartbreaking. It is not what we expected of this merger, and quite frankly, it makes me mad. It makes me angry that we all and you all are having to struggle with fighting for the basic right of getting the agreements that were promised and committed when this merger was contemplated in the first place. So we want every single person to feel like they have access to care in there, you know, that is right there for them, so that they don't have to think about struggling with making decisions that keep them from the care that they desperately need when they need it. And I want to thank you all for telling your brave stories, and for being brave for us. And you know, you've had amazing electeds here on the call fighting with you, alongside you. I want to also offer my support and my care and my intention to be able to be right there alongside you as well, so that we can have the kind of community-based healthcare that we all deserve, particularly in Oakland, particularly during this time. And thank you for being incredibly brave for us.
Thank you, and thanks to all of the speakers. We're going to take a few moments now for questions and comments. So again, if you would like to ask a question, just click that Q&A button that's at the bottom of your Zoom screen, and a window will pop up, and then you can enter your questions there. Please specify who your question is for. If you have a particular panelist, or it can just be for all of the panelists, and we will try to get to as many as possible. Let's give folks a minute to look at that. We have one question here. Can anyone elaborate more on how UCSF is explicitly focusing on profit over the lives and well-being of children and their families? Is there a panelist or someone who would like to respond to this question?
This is Martha. I made that comment, so I'd be happy to try. It is, it's been clear to us that with how we are hearing from management around positions, is they talk about it in terms of efficiency. They talk about, they actually closed a clinic for a rare disease called tuberous sclerosis and laid off a nurse practitioner who was a nationally known expert in that field, because they said she wasn't efficient in providing care, right? She wasn't seeing enough patients per, you know, and they had charts and graphs. And they were looking at it in terms of not what the patients and family needed with a rare disease that affects kids, but it wasn't profitable. So that's an anecdotal example, but it was an incredibly serious example. And they've eliminated positions, and our staffing shortage is certainly being experienced by all of us as the classic speed up, right? Work faster, work harder all the time. And we're all dedicated, so we do. Yeah.
Thank you so much for that response. We have a second question here in the Q&A. What can we do to help keep CHO in Oakland? So again, I'll turn it over to the panelists and anyone who's spoken if you'd like to respond to this question. What can we do to help keep CHO in Oakland?
You know, I don't want to speak all the time, but we have the Alameda Labor Council did recently pass a resolution that is being taken around to other labor councils, especially in the counties where we serve all these patients. And it's being, they're contacting the regions who are ultimately in charge. And we're working with city councils around the Bay Area on having cities pass this resolution as well. And UCSF is susceptible to this kind of pressure, we hope. And we also have petitions and lawn signs and window signs, if you know, so there's lots of things we can maybe make available for people to actually do.
Thank you so much. And Clarissa, I see your hand raised. Do you also have a response to this question?
Hi, yes. I just wanted to quickly say that, you know, in March of 2020, we passed Measure C, which is now, and Measure C is a half-cent sales tax that provides between 150 and 160 million dollars a year annually. So we're talking about up to $3 billion over 20 years in resources to our care economy. And right now that initiative, though it is legal and there's legal precedent for us to implement it, is actually being stalled in a court process by right-wing conservative anti-tax groups that really want to get in the way of our communities making funding decisions about life-affirming services. And so I just want to encourage everyone to stay in touch with NUHW, Parent Voices Oakland, and Care for Kids Coalition. We fought very hard, got 85,000 signatures to put this on the ballot. I also want to acknowledge the late Supervisor Wilma Chan. This was one of the last, massive initiatives that she worked on besides Measure W, and really in her legacy and name, encourage everybody to get involved, because this does provide funding for critical care services and staffing in Children's Hospital. And I also want to encourage folks to, pay attention and make sure that in this initiative, it's one thing to pass these initiatives, it's another to implement them and make sure that those funds go where they need to go. And so in supporting the workers in having community and worker oversight for the funding. So I just encourage everyone to get involved in that fight. We still have work to do.
Thank you so much. And we have time for just one more quick question. How was CHO able to afford resourcing these programs and providers before the merger? And has the administration explained why there seems to be less funding available?
Before the merger, they were eligible for disproportionate share funds, and as healthcare funding changed over time, there was less of that. And part of what UCSF has been doing, as far as we can tell, is they are with the changes they're instituting, they're shifting a lot of the resources away from children's, obviously. And I just want to say that I know we had that incredible foundation that people contributed to year after year after year because of our mission to provide care to anyone, regardless of ability to pay, no matter who you were or what you needed. And that mission is, as one of the patients, as Ashley was saying earlier, it feels a little shifted here. And so I think and now that UCSF Benioff's in the name, would you contribute to that charity? Is that a charity, UCSF Benioff? So there's lots of reasons why maybe we're experiencing this. And I think it's purposeful. They're in charge of the budget. They know how to run a hospital profitably. They could do it. They've chosen not to. I'm sorry I'm speaking on this, but we're all suffering. And it's not us as much as it is our patients and families.
So true. Thank you so much for that response. I know there are probably a lot more questions out there, and of course these conversations are going to continue, but we're going to close off the question session for it now. I'll pass it back to Umberto.
All right, well, very good. Thank you, Yari, and thank you all for the comments indeed and the questions. So you all in the questions have been anticipating the remarks to follow. You know, the central question is, what are we going to do? What are we going to do about that situation? So we're already doing it. This is part and parcel of what we're doing. We're forming a community coalition to support Children's Hospital to honor workers, patients, and community members' demands to have a voice in the future of our hospital. It can't just be top down. Yes, that's not going to work for us. Because too many of us would go without, and we can't have that. If you find anything you've heard tonight troubling, or you believe kids in the East Bay deserve accessible, high-quality healthcare, we'd like your help. Indeed, let's join together. If you register for this town hall, we have your info, and we will be reaching you again with next steps, so please stay tuned. As we bring this town hall to a close, we'd like to start by thanking attendees for being here and supporting this community dialogue. This is an issue that impacts many of us throughout the East Bay. Before we end the town hall, we're going to take just a moment and ask speakers to share their hopes for how we continue to drive this conversation forward and what kind of community engagement could help support this fight to help keep care in Oakland. Keep it quality, keep it accessible. So, let me first call on Clarissa to see what thoughts you have on how we continue to drive this forward. You've already shared a little bit. Maybe you want to reiterate, maybe you add a flourish or two.
I love flourish. So I think I wanted to just mention the culture aspect that was, I cannot emphasize enough how important it is that we preserve, that we protect, and that we uplift the incredible culture of community and patient-centered care that is that Children's Hospital is known nationally for. I think research is important. I think all of the different departments, but when the intersection between environmental racism that you see in Oakland, that African-American children are suffering from asthma and respiratory illnesses, among other things, the understanding and orientation to all of the issues that go into supporting our community it's rare and it's important. And so I guess, I would just say that we should continue to have these discussions with patients and for folks to be able to share their stories. And I'm really excited to see elected officials here in support of the workers, especially, and to hear and understand and know that people really care about what's so special and what makes, the workers and Children's Hospital in Oakland so important.
Thank you. Thank you for those additional comments, Clarissa. And now let me pass the mic to Martha for a turn on the question. How do we continue this conversation? How do we come forward? How do we maintain engagement?
I think that this is what, like you said, this is a beginning of many people coming together. We would thank Dan Kalb for having a forum earlier this year. And we're thanking everybody present, the electeds. They are, as Dan said, he's beginning to work on maybe getting a resolution passed in Oakland. And since it's Children's Home, that's a good place to start. I think that one of the things that we've been doing is just being public in front of the hospital from time to time to actually hand leaflets to families with how to contact us if they're having issues or who to contact. And maybe we can do some of those. And we've certainly worked together with NUHW in some of those actions. And we appreciate, we're stronger together. And bringing in the community, Clarissa, and the patients, Ashley, and the electeds, all of you, it's really a great start.
Thank you, Martha. And let me hasten to add that we've had up to 106 participants. So this begins something. This begins us coming together in some important way. And we still have a little over 80 with us. So last but not least, I'd like to invite Frances Merriweather to share her thoughts on the question. Your mic is off.
I think it's been said beautifully by everyone who preceded me. It's collaboration. And working with all groups who are committed to keeping children's in our community and staffed and providing services the way that we know that we can. And I think keeping in mind, we speak for families who are so overwhelmed that maybe it's difficult to do this. You know, they want the services, they want to be part of keeping children's the top-notch hospital that we know it can be. And sometimes they're dealing with so much that they aren't able to participate on that level. So I think about keeping in mind that we are working for them. We're working for our colleagues, and we're working for the families that are just trying to survive, just trying to make it happen from day to day. And I just also want to say our case managers did an incredible job during this pandemic to make sure literally people had food and had shelter. So I also wanted to mention that, but keeping in mind families who need us to be the voice, not in a patriarchal way, but in a way that we understand their struggles.
Thank you, Fran. Thank you, Fran. It seems to me that care for the healthcare worker and care for the families and children are intimately bound up together.
Yes.
Yeah, if you draw the equation in some strange way, things fall apart for all of us.
Yeah.
Okay, so let me open up the floor to panels to see if anybody else would like to share a final thought on how to how to drive this conversation forward, how to maintain community engagement for the sake of keeping healthcare strong and accessible in Oakland. I'll pause and see if anybody has an additional thought.
Yeah, I think that solidarity is if you ask me one word, it would be all about solidarity. If we're stronger together as a community, taking care of our patients and the community, we all win if we are together. So that's my input.
Thank you very much. And let me pass it on to Yari here for some near the final thoughts. We're running a little over here. Bear with us. We're almost there. Go ahead, Yari.
Just wanted to say thank you to all of you. So glad to be here in solidarity with you. And you're right on. Like, it takes building power, and that means that we have to be together. East Bay DSA, as fellow residents and workers and patients here, you know, we stand with you, and we're so excited to be on this call and really bringing together a coalition of people to build the power that we're going to need in order to win this fight.
Well, as they say in the cartoons, that's all, folks. At least the cartoons that I watched when I was a kid. Maybe I'm dating myself here. We'll continue to update you on how you can get involved to save our hospital and keep our East Bay kids healthy. Thank you all again for coming out. Stay safe and healthy, and stay tuned. And enjoy your dinner if dinner's ahead of you.
Thanks, everyone. Good night.
Hey, can the panelists stay on for a minute so we can do a quick screenshot? If you could come on camera real quick, just, you know, pics or it didn't happen. Martha,
I can't. It says the host has stopped it. So that's why I wasn't turning my video.
Oh, no.
Now I got a permission.
Okay. Ask and you shall receive. All right, let's do this real quick. Okay, everybody, check your camera. Okay. 1, 2, 3. Okay, great. Thank you.
Bye.
Bye, everyone.
Well, bye. Bye.